Depression is one of the most common mental health challenges faced by people in the UK and worldwide. According to the NHS, around 1 in 6 adults experiences symptoms of depression at any given time, ranging from low mood and fatigue to difficulty sleeping, loss of interest in daily activities, and feelings of hopelessness. Treatment for depression in the UK usually involves a combination of approaches, including talking therapies such as cognitive behavioral therapy, CBT, medication such as antidepressants, lifestyle adjustments, and peer or group support. These interventions are evidence-based, backed by extensive research, and remain the cornerstone of recovery for many individuals. However, an increasing number of people are also exploring complementary approaches to support their NHS treatment plans. Among these, hypnosis, or hypnotherapy, has gained attention as a potential tool to assist with symptom management, stress reduction, and emotional resilience. This article will explore how hypnosis may support individuals living with depression, how it can complement NHS guidance, what the science says, and how to use it responsibly as part of a broader recovery journey. Before looking at hypnosis, it is important to understand depression in its modern healthcare context. The NHS defines depression as more than just feeling unhappy or fed up for a few days. When low mood persists for weeks or months, interfering with daily life, it may be diagnosed as depression. Persistent sadness or low mood. Loss of interest or pleasure in usual activities. Fatigue or low energy, sleep disturbances, insomnia or oversleeping, difficulty concentrating or making decisions, feelings of guilt, worthlessness, or hopelessness, physical symptoms such as aches and changes in appetite. In severe cases, thoughts of self-harm or suicide. The NHS typically recommends a stepped care approach, meaning the level of treatment matches the severity of symptoms. For mild depression, lifestyle changes, guided self-help, or talking therapies may be recommended. For more severe cases, medication and structured psychological support are often advised. While NHS guidance forms the foundation, complementary strategies like hypnosis may help individuals better manage stress, regulate emotions, and create a more positive mindset. Hypnosis is a natural state of focused attention and deep relaxation. It is not the same as sleep. Instead, it is a heightened state of suggestibility where the mind becomes more open to positive ideas and new ways of thinking. In therapeutic contexts, a trained hypnotherapist uses guided relaxation, visualization, and positive suggestion to help a person access this state and work through unhelpful thought patterns. Hypnosis is not mind control. The individual always retains awareness and control. It is not a cure for depression but can act as a supportive tool. Hypnotherapy should only be carried out by trained professionals, ideally those registered with professional bodies such as the British Society of Clinical Hypnosis, BSCH, or the National Council for Hypnotherapy, NCH. Hypnosis cannot replace NHS-recommended treatment, but research and clinical practice suggest it may help in several ways. 1. Stress and anxiety reduction. Many people with depression also experience high levels of stress or anxiety. Hypnosis induces a state of deep relaxation, lowering the body's stress response. This can help reduce cortisol levels and promote a sense of calm. 2. Reframing negative thinking. Depression is often fueled by unhelpful, repetitive thought patterns such as "I'm not good enough" or "things will never get better." Hypnosis may help individuals access the subconscious mind and reframe these patterns through positive suggestions. 3. Enhancing self-esteem. Guided hypnotherapy can incorporate affirmations that strengthen self-worth and confidence. For example, suggestions might focus on recognizing small achievements or cultivating self-compassion. 4. Supporting sleep. Insomnia is a common symptom of depression. Hypnotic scripts can include relaxation exercises and sleep imagery, helping individuals wind down and improve rest. 5. Motivation and energy. Depression often brings lethargy and lack of motivation. Hypnotherapy can introduce imagery and suggestions that encourage gentle action, energy renewal, and gradual goal setting. 6. Complementing CBT and talking therapies. CBT works by identifying and challenging unhelpful thoughts. Hypnosis can reinforce this process by embedding positive reframes at a subconscious level, making the benefits of CBT more lasting. Research into hypnosis as a treatment for depression is ongoing, and while results are promising, it is important to stress that hypnosis should not be seen as a standalone cure. A 2019 systematic review found that hypnosis, when combined with CBT, was more effective in reducing depressive symptoms than CBT alone. Studies on relaxation techniques show that hypnotic relaxation can significantly reduce anxiety and improve mood, both of which are relevant for depression. Neuroimaging research indicates that hypnosis can influence brain regions linked to emotional regulation, suggesting it may help rewire certain automatic responses. While hypnosis is not yet part of standard NHS protocols for depression, it is increasingly recognized as a complementary therapy for stress, pain management, and emotional well-being. If you choose to explore hypnosis alongside NHS care, here's what a typical session might look like. Initial consultation. The hypnotherapist will ask about your mental health history, current treatment, and personal goals. They should always encourage you to continue following your NHS plan. Induction. The therapist will guide you into a relaxed, focused state, often through breathing exercises or visualization. Therapeutic suggestions. Once in hypnosis, you may hear positive suggestions such as, "You are capable of making small, positive changes each day." You can begin to see yourself as stronger and more resilient. Your mind and body can find calm and peace. Visualization. You may be guided to imagine safe, peaceful places or see yourself overcoming challenges. Emerging. The therapist gently brings you back to full awareness, refreshed and alert. Sessions typically last 50 to 60 minutes, and many people benefit from a series of sessions rather than a single one. In addition to working with a therapist, many people use self-hypnosis or guided audio recordings. These tools can be practiced at home, helping reinforce relaxation and positive thinking between sessions. Tips for self-hypnosis practice. Set aside 15 to 20 minutes in a quiet space. Use headphones for immersive listening. Focus on your breathing and allow your body to relax. Repeat positive affirmations such as, "Each day I find reasons to keep going. I can face challenges with calmness and strength." Use visualization, such as picturing a brighter future or recalling times of personal success. Consistency is key. Daily practice is more effective than occasional listening. Hypnosis is generally safe, but it should never replace NHS care. Always consult your GP if you are experiencing symptoms of depression. Hypnosis should not be used if you have severe mental health conditions, such as psychosis, without medical supervision. Choose a qualified hypnotherapist who understands how to work with depression. Continue with prescribed medication or therapies unless advised otherwise by your doctor. If you experience suicidal thoughts, seek immediate help from NHS Urgent Services, Samaritans, 116 123 in the UK, or your local crisis team. The NHS emphasizes a holistic approach to mental health recovery. Hypnosis fits into this model as a complementary tool, not a replacement. Use hypnosis to manage stress and promote relaxation. Combine it with CBT techniques learned through NHS services. Support medication adherence by reducing anxiety around side effects. Encourage lifestyle changes such as better sleep, exercise, and diet. By weaving hypnosis into existing NHS care, individuals may experience a more balanced, supportive recovery journey. If you are considering hypnosis for depression support in the UK, check professional registers. Look for practitioners registered with BSCH, NCH, or the Complementary and Natural Healthcare Council, CNHC. Discuss with your GP. Let your doctor know you are exploring hypnosis so they can ensure it aligns with your care plan. Explore NHS-approved resources. Use services such as NHS talking therapies for structured psychological support alongside hypnosis. Start small. Even 1 or 2 sessions can help you decide if hypnosis feels beneficial. Practice self-care. Remember that hypnosis works best as part of a larger well-being plan that includes rest, nutrition, exercise, and social connection. Depression is a complex condition that requires thoughtful, evidence-based care. In the UK, the NHS provides an essential framework of support through talking therapies, medication, and structured recovery plans. Hypnosis, while not a substitute for these treatments, can offer valuable complementary support. By reducing stress, reframing negative thoughts, and promoting relaxation, it can enhance emotional resilience and reinforce NHS-guided strategies. When used responsibly, alongside medical advice and professional guidance, hypnosis can be a gentle, empowering tool on the path to recovery. If you are considering hypnosis for depression, take it as one piece of a bigger picture. A supportive, multi-layered approach to mental health that honors both medical science and the mind's innate ability to heal.